Hey there, curious minds. Ever wondered what secrets your maxilla bone is hiding? Get ready to uncover some of the most bizarre facts about this often overlooked part of your face. Today, we're delving into the world of facial anatomy to shed some light on the intriguing maxilla bone. While it may not be as popular as the femur or the skull, the maxilla plays a crucial role in shaping our facial features and overall appearance. Get ready for a roller coaster ride of 10 bizarre and lesser-known facts about the maxilla bone. Key features and anatomical relations. Each maxilla articulates with the opposite maxilla, lacrimal bone, palatine bone, frontal bone, ethmoid bone, zygomatic bone, nasal bone, vomer, inferior nasal concha. Ossification. Ossification of each maxilla occurs at one ossification center in its body, which appears in utero during the second month and also forms the zygomatic, frontal, alveolar, and palatine processes. Variations. In some individuals, accessory infraorbital foramina may be present. The maxillary sinus may be underdeveloped or contain a septum. The incisive portion of the alveolar process may not be fused with the rest of the maxilla, resulting in the presence of an os incisivum. The maxilla also displays sexual dimorphism, where the maxillae in males are relatively larger than those in females. Regarding surface anatomy, the body, alveolar process, and palatine process of the maxilla can be palpated. List of clinical correlates. Fracture of the maxilla, for example, Lefort fractures, cleft palate, maxillary hypoplasia. Parts of maxilla. The alveolar process alveolar part is the thick, curved, inferior projection found along the inferior aspect of the maxilla. Provides an origin site for the buccinator muscle. The alveolar processes of both the right and left maxillae combine to form the maxillary alveolar arch, which lodges all of the maxillary upper teeth. The body is the centrally located, large pyramidal part of the maxilla. It consists of the maxillary sinus and 4 processes extend from it. A superiorly located frontal process, an inferiorly located alveolar process, a laterally located zygomatic process, a medially located palatine process. The frontal process nasal process is the thin, long, superior projection found along the anterosuperior aspect of the maxilla. Contributes to the formation of the lateral wall of the nasal cavity. The palatine process is the thick horizontal, medial projection found along the inframedial aspect of the maxilla. The palatine processes of the maxilla combine to form the anterior 3/4 of the bony hard palate, while the horizontal plates of the palatine bones combine to form its posterior 1/4. The bony hard palate contributes to the formation of both the floor of the nasal cavity and the roof of the oral cavity. The zygomatic process malar process is the thick, rough, lateral projection found along the supralateral aspect of the maxilla. The zygomatic process contributes to the formation of the floor of the orbit. The greater palatine foramen is a small, round, posterolaterally located opening on the bony hard palate. It forms the inferior opening of the greater palatine canal. Each greater palatine foramen is located anterior to the lesser palatine foramina and medial to a 3rd molar tooth. The greater palatine foramen allows for the passage of the greater palatine artery, vein, and nerve. The maxillary hiatus maxillary sinus ostium is a large, irregularly shaped opening found along the nasal surface of a maxilla. The maxillary hiatus forms the opening for the maxillary sinus, thus allowing communication between the sinus and a middle nasal meatus. The incisive fossa is the depression into which the incisive foramina open. It is located along the midline on the anterior aspect of the bony hard palate, posterior to the central maxillary incisor teeth. The incisive fossa allows for the passage of the nasoplatine nerves. The inferior orbital fissure, sphenomaxillary fissure, is a large cleft found along the floor of each orbit. It is located inferior to the optic canal and superior orbital fissure. The inferior orbital fissure allows for the passage of the zygomatic nerve and the infraorbital artery, vein, and nerve. The infraorbital foramen is the small, round, superiorly located openings found along the anterior surfaces of each maxilla, and allows for the passage of the infraorbital artery, vein, and nerve. The nasolacrimal canal is a tubular passage found along the medial wall of each orbit. The nasolacrimal canal allows for the passage of the nasolacrimal duct. The piriform aperture, anterior nasal aperture, is the large, pear-shaped opening found along the anterior aspect of the nasal cavities. The piriform aperture allows for the communication between the nasal cavities and the anteroinferior part of the nose. Surfaces of maxilla. 1. The anterior surface, facial surface, is the area found along the anterolateral aspect of the maxilla. It provides origin sites for the levator labii superiores alecgnasi, levator anguli oris, levator labii superiores nasales, depressor septinasi, and orbicularis oris muscles. The ethmoidal margin, ethmoidal border, is the thin, medially located border of the orbital surface of the maxilla. The ethmoidal margin articulates with the orbital plate of the ethmoid bone. 3. The infratemporal surface, posterior surface, is the area found along the posterolateral aspect of the maxilla. Consists of the maxillary tuberosity and alveolar foramina. Provides an origin site for the medial pterygoid muscle. Forms the anterior wall of the infratemporal fossa. 4. The lacrimal margin, lacrimal border, is the vertical, posteriorly located border of the frontal process of maxilla. The lacrimal margin articulates with the lacrimal bone. 5. The lacrimal notch is the anteriorly located indentation found along the medial border of the orbital surface of the maxilla. 6. The nasal margin, nasal border, is the thin, rough, anteriorly located border of the frontal process of maxilla. 7. The nasal notch is the large, deep indentation found along the anteromedial border of the body of the maxilla. 8. The nasal surface is the area found along the medial aspect of the maxilla. 9. The orbital margin, orbital border, is the smooth, concave, anterosuperiorly located border of the maxilla. It separates the anterior and orbital surfaces of the zygomatic bone, provides an origin site for the orbicularis oculi muscle, and an attachment site for the medial palpebral ligament. 10. The orbital surface is the smooth area found along the superior aspect of the maxilla. It provides an origin site for the inferior oblique muscle. 11. The palatine surface is the concave area found along the inferior aspect of the palatine process of maxilla. 12. The zygomatic margin, zygomatic border, is the rough, supralaterally located border of the maxilla. The zygomatic margin articulates with the maxillary border of the zygomatic bone. Landmarks. 1. The anterior lacrimal crest is the ridge found along the posterolateral aspect of the frontal process of maxilla. The anterior lacrimal crest forms the medial portion of the orbital margin of the maxilla. provides an origin site for the orbicularis oculi muscle and an attachment site for the medial palpebral ligament. 2. The canine eminence is the prominence found along the anterior surface of the maxilla. It is located superficial to the socket of the canine tooth. 3. The canine fossa is the large, deep depression found along the anterior surface of the maxilla. It is located inferior to the infraorbital foramen and provides an origin site for the levator anguli, oris muscle. 4. The conchoid crest is the oblique anteriorly located ridge found along the nasal surface of the maxilla. 5. The dental alveoli, alveolar cavities, or tooth sockets, are the small cavities found along the inferior aspect of the alveolar process of each maxilla. They lodge the roots of teeth and can vary in morphology depending on the type of tooth they each accommodate. In adults, there are normally 8 dental alveoli on each maxilla, giving a total of 16 dental alveoli found across the entire maxillary alveolar arch. Adjacent dental alveoli are separated from each other by interalveolar septa, and the dental alveoli for some teeth are subdivided by interradicular septa in order to accommodate teeth that have more than one root. 6. The ethmoidal crest is the oblique, anterosuperiorly located ridge found along the nasal surface of the maxilla. 7. The greater palatine groove is the shallow, oblique, posteriorly located depression found along the nasal surface of the maxilla. It travels supromedially from the greater palatine foramen and is converted into the greater palatine canal by its combination with the greater palatine groove of the palatine bone. This canal allows for the passage of the greater palatine nerve and vessels. 8. The infraorbital groove, infraorbital sulcus, is the shallow, posteriorly located depression found along the orbital surface of the maxilla. The infraorbital nerve and vessels pass through this groove. 9. The orbital margin marks the anterior border of the eye socket. 10. The interalveolar septa are the small partitions found along the inferior aspect of the alveolar process of each maxilla. They separate adjacent dental alveoli tooth sockets. 11. The interradicular septa are the small partitions found in some dental alveoli tooth sockets. They subdivide dental alveoli into smaller cavities in order to accommodate teeth that have more than one root. 12. The lacrimal groove is the vertical, deep depression found along the nasal surface of the maxilla. This canal allows for the passage of the nasolacrimal duct. 13. The maxillary tuberosity, maxillary eminence, is the rounded, inferiorly located projection found along the infratemporal surface of the maxilla. It provides an origin site for the medial pterygoid muscle. 14. The nasal crest is the medially located ridge found along the superior aspect of the palatine process of maxilla. The nasal crests of both the right and left maxillae articulate with the inferior border of the vomer. 15. The palatine grooves are the two curved, shallow depressions found along the palatine surface of the maxilla. The greater palatine nerve and vessels pass through these grooves. Sutures. 1. The ethmoidomaxillary suture, maxilloethmoidal suture, is a fibrous joint found along the orbit of the cranium. It is the articulation site located between the orbital plate of the ethmoid bone and the orbital surface of the maxilla. 2. The frontomaxillary suture, maxillofrontal suture, is a fibrous joint found along the anterolateral aspect of the cranium. It is the articulation site located between the nasal margin of the frontal bone and the frontal process of the maxilla. 3. The intermaxillary suture is a fibrous joint found along the anterior aspect of the cranium. It is the articulation site located between the bodies and alveolar processes of the right and left maxillae. 4. The lacrimoxillary suture maxillolacrimal suture is a fibrous joint found along the orbit of the cranium. It is the articulation site located between the lacrimal and maxillary bones. 5. The median palatine suture is a fibrous joint that separates the bony hard palate into right and left halves. It is the collective term for two articulation sites. The anterior articulation site, located between the palatine processes of the right and left maxillae. The posterior articulation site, located between the horizontal plates of the right and left palatine bones. 6. The nasomaxillary suture maxillonosal suture is a fibrous joint found along the anterior aspect of the cranium. It is the articulation site located between the lateral border of the nasal bone and the frontal process of the maxilla. 7. The palatomaxillary suture maxillopaplatine suture is a fibrous joint found along both the lateral bony wall of the nasal cavity and the floor of the orbit. It is the articulation site located between the lateral aspect of the palatine bone and the posteromedial aspect of the maxilla. 8. The transverse palatine suture is a fibrous joint that separates the anterior 3/4 of the bony hard palate from its posterior 1/4. It is the articulation site located between the palatine processes of both the right and left maxillae and the horizontal plates of both the right and left palatine bones. 9. The zygomaticomaxillary suture maxillozygomatic suture, or infraorbital suture, is a fibrous joint found along the anterior aspect of the cranium. It is the articulation site located between the maxillary border of the zygomatic bone and the zygomatic process of the maxilla. Craniometrics. 1. The anterior nasal spine acanthion is the pointed, anterosuperiorly projecting process found along the midline on the anterior aspect of the cranium. It is formed by both the right and left maxillae and is located at the superior end of the intermaxillary suture. The anterior nasal spine provides an attachment site for the cartilaginous part of the nasal septum. 2. The dacryon is a craniometric point found along the lateral aspect of the cranium. It is formed by the lacrimal bone, maxilla and frontal bone, and is located at the area where the lacrimoxillary suture meets the frontal bone. 3. The prostheon is a craniometric point found along the midline on the anterior aspect of the cranium. It is formed by both the right and left maxillae and is located at the most anterior portions of their alveolar processes. 4. The zygomaxillaire is a craniometric point found along the anterior aspect of the cranium. It is formed by the maxilla and zygomatic bones and is located at the inferior end of the zygomaticomaxillary suture. 5. The zygoorbital is a craniometric point found along the anterior aspect of the cranium. It is formed by the maxilla and zygomatic bone and is located at the area where the zygomaticomaxillary suture meets the orbital margin. Understanding the maxilla is crucial for maintaining overall dental health. I hope you found this deep dive into the maxilla as fascinating as I do. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel for more insightful content. And if you have any questions or topics you'd like us to cover, leave a comment below. Your oral health is our top priority, so stay informed and stay healthy.